Hi, I am mel-low. Really nice to meet you. Welcome to my small clinic. How can I help you? It's your first time here. Well, let's get to know each other a tiny bit. I will ask you a few personal informations. First start, your full name, please. Age and date of birth. Great. Now, I will need a contact number. And an emergency contact. Great. What is your current occupation? And your marital situation? Great. So, you just moved in. Congratulations. How are you feeling? Good? Okay. Oh, no, I think it's a great idea to look for a physician when you can. That way, when you will need me, your file will be already created and you know where to go if you have any health issues, So now that's a great idea. So, you have time? Great. I'm going to create your file, then that way I will have all the information concerning you, about you. Have a seat, stay, keep, relax, get comfortable, the usual. Okay, so, about your file. We need a few new pages. Okay, good. So, I will start asking about your current health. Okay. Do you have any ongoing health issues? Okay. Are you experiencing any pain? Where are those located and how severe? Okay. You said your age was? Okay. Good. Do you experience any other symptoms like fatigue, weakness, fever, dizziness? Do you spend a lot of time on screen? Okay. It's the world we are living in. No judgment at all. Great. Now about your medical history. Have you been diagnosed with any medical condition in the past? Diabetes, hypertension, asthma? Okay. And have you had any surgeries or hospitalization? If yes, I will need the dates and reasons. Okay. Do you have any allergies, including medication, food, environmental? Just getting comfortable myself. Okay. Thank you. Are you taking any medication, including prescription, including over-the-counter, vitamins, supplements, plant, plant treatment, herbal treatment? Yes. Mm-hmm. Okay, great. Are you up to date on vaccinations? Thanks. Now about your family history, medical history. Um, does anyone in your family have a history of significant health issues? Heart disease, cancer, diabetes, genetic disorder, anything? Mm-hmm. Okay. Is there any history of mental health condition in your family? Mental health condition. Okay. And did any close family members pass away from health-related condition? Okay. So now about your lifestyle and habits. Moving on. Do you smoke or have you ever smoked? If yes, I will need the frequency, duration, and if you quit, I will need the date when you quit smoking. Mm-hmm. Great. Do you consume alcohol? And same here. If yes, I will need the frequency, the type of alcohol, the quantity, amount. Okay. Do you use any recreational drugs? Same here. Type, frequency. Okay. And how would you describe your diet? Do you have any dietary restriction? Mm-hmm. How many meals a day? Okay. So, do you exercise? What type? Frequency? And important, how would you rate your sleep quality? Do you suffer any issues such as insomnia, sleep apnea? Can recommend you a colleague if necessary. I can recommend you a colleague if necessary. For that, just let me know. Your mental health now. Do you experience any mental health issues in the past or currently? It can be depression, it can be anxiety, it can be any mood disorder. Okay. Have you ever been diagnosed with a mental health condition or receiving therapy or counseling? Great. Does it help? Do you feel safe at home and in your relationships? And are you experiencing any stress, anxiety at work, at home? Okay. So, about your reproductive and sexual health now, are you currently sexually active? And if yes, do you use any form of contraception or protection? Okay, great. Now, about preventing health and screening. Do you get regular health screenings, blood pressure, cholesterol tests? When was the last one? Okay. When was your last physical exam? Not too long ago. That's good. When was your last dental and vision checkup? Okay. Do you have any concern about specific parts of your health? We can certainly take a look at that. Do you have any chronic symptoms such as headaches, joint pain, digestive issues? And are you experiencing any changes in appetite, in weight, energy level? Is there something more you want to tell me? Okay. So, I've got all I need for your file. I'll be really happy to be your new physician. Do you want me to take a quick look at you before you go? Well, just a quick look, don't worry. Just making sure that you are feeling good. That there is no reason at all. So, let me check your neck. I will take a look inside your mouth. If there is any problem. So, say ha. Okay. Okay, good. Let me feel your throat. Okay. The thyroid maybe. I may have to check it. Does it hurt? No? Great. I think I'm going to prescribe blood test for next time. I cannot do this right now because you cannot eat or drink before. So you will have to come back. Otherwise, no fever. Okay. It might be just because you are under a lot of pressure at work. It can be your thyroid as well. So I will just take a little bit of your blood next time, just to check that. Okay. When will you be available? Next week? Great. Same time? Great. That's not it for me. It was a real pleasure to see you today and to meet you. Welcome to the neighborhood. And I will see you soon. Great. Have a lovely rest of the day. Take care. Goodbye. Hi. For today, I was thinking about performing a realistic cranial nerve on you. I actually do some research and I think it appears to me that I never performed true cranial nerve on you. So let's do that today. If you consent, of course. I will be checking my notes during the whole process, as well as taking some notes. Good. So, a cranial nerve examination, just to assess your brain and nerve function, and making sure everything is good. Let's start, shall we? I think first I will ask you a few questions and need your answers to proceed, to have a better understanding of your condition, of your actual condition, okay? Have you had any recent injuries or illness? Great. Any changes in your sense of smell, taste, or in your vision? Okay. Any difficulties swallowing or speaking? Any difficulties at all? Any facial weakness or tingling? Last question. Any hearing problem or ringing in your ears? Thanks a lot for all your answer. Let's start the cranial nerve examination. For that, we are going to begin with the first nerve. It's the olfactory nerve. For that, I will put on, I think, at least a glove. Right. So, yes, I am going to test your smell of scents. I will use for that small bottles with perfume inside. I've got 3. This one, and this one. Great. For the first one, both nostrils, tell me, yes, if you can smell the perfume. What are you smelling? Correct, lavender. For the second one, I will be closing one nostril and you will. Yes, this one is strong. Tell me if you can smell it, okay? Closing one nostril and it's coffee. Great. Can you smell it with the other one? Coffee, great. And last one. Checking a little bit. We are going to proceed exactly the same. One nostril. It is mint. And just checking the other one, just to be sure. Great, mint. Any difficulties at all with this? So you did smell correctly the lavender, the coffee and the mint, which is good. So I think your olfactory nerve seems working perfectly. Let's move on to your optic nerve. For that, I will be needing my chart. Here, about here should be a very nice distance. Can you read the smallest line you can see? The smallest one. Okay. Great. Just pressing this right here. And another test. Yes. Just test your peripheral vision. Can you focus on my nose? Focus on my nose and tell me when you see my fingers wiggling in your field of view. Okay? Okay, once again. Okay. Okay. seems correct. So the reading short was a piece of cake for you, as well as the peripheral vision. I'm just going to check the pupillary light reflex. And for that I will need my light. Here we go. Great. For that, just look straight ahead. Focus on my nose if you want, or anything in the background will do. I will unfortunately use this pen light. It might be very bright for your eye, but try not to close it, as I can see your pupil reaction to it. Okay, so I'm going to mask one eye like this, and okay. Let's see differently. I'm going to see. Okay. Very good. Very good. No need to use it more. Very nice reaction. Okay. Now I'm going to keep this for this one. Let's move on to the nerve 3, 4, and 6. The oculomotor trochlear abducens, which is your eye movement. So yes, we just did the nerve 1, the olfactory nerve, the second nerve, the optic nerve, and now moving on to the nerve 3, 4, and 6 for your eye movement. Okay. Keep your head straight. Don't move your head during this test. You will need to follow my fingers, but only with your eyes, okay? I just want to see your eyes movement for this one, okay? Great. So, starting here, look at my fingers and follow them. Very good. Up, 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 up. And down. Right here. Okay. Let's try this. Okay. Just try to follow the blue ball with your eyes only. Okay, very cute. Just checking your eyes, eye movement, which is good. This direction and this direction. Okay, very nice. Did you experience any double vision during this test? Sorry, or dizziness? Okay. Nerve number 5, which is the trigeminal nerve. It's facial sensation and jaw movement. For that I will need a tool, and I guess I will use this one. Okay, I will touch areas on your face softly, very gently, and you will tell me if you can feel it, okay? Great. Okay. Good. Fantastic. Now I need you to close your eyes. I'm still going to touch your face with this, and I want you to tell me where do you feel the sensation, okay? So close your eyes and okay. Great. Fantastic. And last one. Very good. Now, a small, not this, but maybe this. The sensation may be completely different, yes. I will use for this one 2 tools, okay? A sharp one, like this, and a dull one, like this, okay? I need you to keep your eyes closed and tell me which one you feel, okay? The sharp feels like this, and the dull like this, okay? Great, let's begin. Correct. Good. Yes, it is. Okay. Okay, good. Great. Fantastic. You can now open your eyes. Very good. away now. It's down. So facial sensations. Oh yes, your jaw movement now. I need you to clench your teeth. That way I will be able to feel your jaw muscle, okay? Clench your teeth. Okay. Okay, good. And yes, try to open your mouth while I apply a small resistance. Don't worry, I won't pull too hard, I won't push too hard, but try to open your mouth. Great. Now I will maintain your mouth closed. Try to resist and open your mouth. Resist it. Correct. Yeah, that's it for nerve number 5. Let's move on to nerve number 7, which is your facial nerve. Can you please raise your eyebrows for me? Good. Now, can you close your eyes tightly? Okay. I will try to open them. Once again, no hard effort. We'll try to slightly open them. Try to resist me, okay? Okay, the other one. Very good. Can you smile widely? The very large smile. Checking on both sides of your smile. Great. And now puff out your cheeks. Good, very good. That's it. Any weakness during any of this expression? Difficulties? No. Okay. Moving on to nerve number 8, the vestibulocochlear nerve, the hearing and balance nerve. Close your eyes and tell me on which side you can hear my fingers moving like this. Okay. Close your eyes. Great. Correct. Very good. Fantastic. Now, just checking if you can hear this. both here. Great. Can you hear this? Sorry. Both ears as well. Great. Can you tell me which one is the more grave? Is it number 1 or number 2? Okay. Very cute. Now, can you hear this one? On both ears as well. Fantastic. And can you tell me if you hear a difference between this and this? What can you tell me about those two? Very good. Okay. Okay. Put your feet together, close together, great. Close your eyes and stay still. Okay? Is it difficult for you to hold balance? Not at all. Seems pretty still for me. That's good. Okay, you can open your eyes. So that's it for nerve number 8. Now, nerves number 9 and 10, which is swallowing and your voice. Okay. I'm going to check your throat for that. I'm going to place my hand on your throat. Okay. Like this. Okay. Can you say ha? A long ah. Okay. Good. Any difficulties? No? Okay. Now, can you swallow? Try once again if possible. Great. Okay. Have you had any troubles swallowing or speaking? Okay. Any changes in your voice? Okay. Moving on to nerve number 11 and the accessory nerve. Okay, so shrug your shoulders against my hands. Great. Okay. Now try to resist the pressure I am applying on it. Okay. Resist it, resist it. Good, good. Now, yes. Turn your head against my head on this side. Try to push it. Okay, great. And now I'm going to try to push your head and you try to resist me, okay? Resist, 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 resist. Okay, same on the other side. Push my hand. Great. And now try to resist it. Try to resist it. Fantastic. Very good. Any pain or weakness during this exercise? Neck pain? Okay. Now, nerve number 12, which is the last one. Yes, can you stick out your tongue for me? Good. Try to move it from one side to the other. Okay, up and down. Fantastic, very good. Okay, now I'm going to need both of my hands for that. Press your tongue against your cheek. Okay, and I'm going to apply a little bit of pressure, and I want you to resist it. Try to push your cheek. Very good. On the other side now. And very good. Fantastic. On the daily basis, any trouble speaking, swallowing, or chewing at all? Okay. Well, you know what? That's conclude our very accurate cranial nerve examination. I hope you enjoyed it as much as I enjoyed making it with you. Do not hesitate to stick by if you need more relaxation. Until then, I will wish you a very good night's sleep and see you real soon, okay? Bye. Hello there. Come in. Have a seat. Great. I am mel-low. I will be conducting your eye exam today. Really nice to meet you. So, as I understand, you are experiencing some discomfort. Can you please tell me more about that? How it manifests? Are you using a lot of screens? Working with a computer, okay? Do you use as well your smartphone for work? Plus for relaxation, of course. Okay, so that's a lot of screen. There is no worry to have for now. It can be just overuse of your eyes, you know? So, be assured I will do a thorough eye checkup just to make sure that everything is in order. Okay? Can I have your name? And date of birth? Great. So, So, complete checkup. First, I will start by examining your eye up close. We'll be using a small light for that part. Just follow my instruction, okay? See, I will be using this small light. So, for the first part of the exam, I need you to focus like on my nose. Look straight and focus at a point that will not be my light, okay? Because I will try to see your pupil response to the light. So, for that I need you to look straight. Okay. Great. While I will be using my light just to see how your pupil is responding. Okay, good. Just try to very good. Okay, now we'll sign. Just try to see. Just focus here. Focus. Focus here. Very good. Okay, now can you just look up for me? Look up. Okay. Now look down. Great. Look to the left. And look to the right. straight back to my nose. Good. Now, totally the opposite. I will be moving the light in front of you, and I need you to try to follow the light moving, but you cannot move your head, only your eyes. Okay? Great. So, good. Once again. Okay. Good. Very good. What if I go a little bit faster? Fantastic. Your eye movement is very good, responsive. So, movement are smooth and responsive. Okay. Now, same thing. I want you to. I don't know if I have something else. No. It will be my pen. Okay. I want you to follow my pen. Okay. So it will be a non-bright object. So just focus on the top of my pen and follow it with your eyes only. With your eyes only. Good. Good. Fantastic. Okay. Look it coming forward and back. And back once again. Cute. For now, everything looks completely fine with your eyes. You never had eye surgery? Great. Now just tell me when you no longer see my fingers, okay? Going to start my nose. Okay. Good. Fantastic. And very good. Just focus on my nose and tell me on which side you can see my fingers moving, okay? Focus on my nose and tell me. Good. 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 Can you see this? And this. Great. Just focus on my finger. Yeah, very good. Now, one eye after the other, okay? We'll be using this to mask one eye. You will tell me how many fingers you can see, okay? How many fingers you can see. Okay, so here we go. Great. The other side now. Good. I will keep this actually because now let's see your ability to read on different sizes. So I will use my chart. And please, we are going to start by the top line, moving to the others. Okay. First line, can you read those two letters? Good. Second line. Very good. This one. Very good. Now this one. Fantastic. This one. This one, but backward, okay? Can you read this line? And this one backward again. Very good. Good job. You are doing great. Don't worry. You are doing great. Now, I will be using some pencils. Can you tell me what color this is? This one? This one? This one? Okay. Is this one darker than this one? Or is it the opposite? Opposite? Great. Now, between those two, which one is darker? Great. What color can you see now? What color are those? Which one is lighter? Yes, that's it. Same for those. What color? Which one is darker now? Great. Very good. Now, I've got a few shapes here. What shape can you see? What about this one? Great. And this one? Fantastic. Okay, that concludes your eye exam. Do you use eye drops? Do you have one? Some? Sorry, do you have some? I think it could help with your comfort because it's clearly due to some overuse. Okay. Try to remember to take some pause when you're working on screen. Just take some pause and try to rest. Drops could definitely help you to feel more comfortable, okay? Great. It was a pleasure to see you today. Do not hesitate to call if necessary, okay? I will be here and I will see you next time. Until then, take care. Goodbye.